Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and host of the Dean's Chat podcast. Our goal, as always, is to bring you leaders in the podiatric profession. Today is no different, but maybe it is a little different. Not only is our guest an accomplished surgeon and educator, but his background story is many things at the same time. This is going to be a story of grit and determination. It's going to show a testing of the human spirit. It is heartwarming, fascinating, and at times unbelievable. Welcome to Dean's Chat, Dr. Mario Cala.
Thank you so much, Dr. Jensen. Really happy to be here with you this afternoon. And thank you for that beautiful words.
Oh, you're welcome. Mario, on the Dean's Chat, we're pretty informal. So let's go with Mario and Jeff. That's all right with you.
That's great.
So before we get started officially, Mario, I thought I'd do a short little bio. Dr. Cala, or Mario, grew up in Cuba. He was trained as a dentist in Camagüey, Cuba. He came to the United States of America in what was an amazing journey and ultimately graduated from the Barry University School of Podiatric Medicine in 2008. Mario completed a 3-year surgical training program at Mercy Hospital in Miami under Dr. Tom Merrill. Then he completed a sports medicine and reconstructive surgery fellowship with Dr. Losito. And I was always jealous, Mario, because you got to go to all the Miami Heat games with Dr. Losito.
That was amazing.
He was a faculty member at Barry University when I was the dean there, also the director of the Jackson North Medical Center at Memorial Hospital. And he's currently practicing in Miami, Florida. I can't tell you how happy I am to have you here on the show today, Mario.
Thank you so much. I'm really happy to be here too.
So Mario, a couple of things. One is you see the new studio here. We've got some plants. I feel like I'm in Miami, right? But I'm in Phoenix and it's hotter than blazes here, but it's a different kind of heat.
Yeah. I can see your plants there. It looks like Miami for sure.
It kind of feels like it. Mario, to get started, I was going to share a story with you. When I was the dean and you and I used to work together every day, I would go home at night. And when I'd walk in the door, I would say, Celia, you are not going to believe the story Mario Cala told me today. And that happened repeatedly, Mario. And I really think that to appreciate your journey in podiatric medicine, I think it's important to start with discussing your life in Cuba. And if you don't mind, is that a good plan from your end?
Yeah, it's okay. We can talk a little bit about that. Well, imagine I was in Cuba in the 90s and in the 2000s. I came to the United States 2003. Okay. And just 7 months after, I was in podiatry school. So that was really difficult for me. But going back to Cuba, I was in Cuba where the political regime was so strict. Still today, to today days, is strict. And I had my visa to come to the United States 1998, but because I was a dentist, they didn't let me go. So they told me, no, you are a dentist, you are an oral surgeon here. You need to work for us 5 more years before we can let you go. So they had me there basically in jail in my own house, working for them with no food, no electricity sometimes. They actually put me in jail a couple of times because they were saying I was against the government. Sometimes because I didn't want to go and work. Another time because I want to leave the country in a boat. But I was in jail several times. So I was kind of like a political refugee at some point. And finally, they let me go. And I arrived in Miami 2003 with a lot of passion, but also a lot of pain to being in my country, my own country, in jail for 5 years. Being a professional there and were not able to do anything to grow as a professional. So I came to the United States with a lot of hunger to do something to myself, to my family, and to help other people all over the world, you know. And that's really difficult for a lot of surgeons, podiatrists, orthopedic surgeons, dentists, and general medicine doctors that came from Cuba or for all these countries when you have communists that you cannot be yourself and you are oppressed under this regime. So it was really difficult for me there.
So let me ask you a question. Let me go back even further, Mario. When you were growing up, what was the path to becoming a dentist in Cuba?
In Cuba, it's really difficult to be a dentist because there are only few schools in the country, like one in Havana, one in Camagüey, and another city is called Santiago. So imagine the whole country wants to go there. So they only have 21 positions at the year that I entered in dentistry for like 5-7 province. We're talking about 1,000 people applying. Uh-huh. So you have to be a really good student and you have to have great grades. They do an acceptance or a test to get inside this university, a dentist university. You need to do a test like similar to the NCAT, but in Cuba. and then they make a curriculum and they make, like an average of people that have the best grades. And I was lucky enough to get in. But yeah, it's really difficult to get in.
Wow. So when you in dental school, it was 4 years?
4 years in Cuba, yeah.
And then when you were done, you went into practice. What was it like in practice, Mario? What was your typical day as a dentist?
Well, that was funny. First, I was practicing in the city, and then when I applied to leave the country, they sent me to a rural area. Oh. In the rural area was really tough because I have to see 30, 40 people every single time that I work. And we're talking about Monday to Friday with no instruments, no lidocaine, no gloves, no materials to help people. So imagine these people, they are not educated people. They're in the rural area, they're farmers, and they get angry, they want to kill you, they have a tooth pain. It was really tough. Sometimes you have to use a lot of psychology to be able to handle all this population that was underserved, actually. And I was the only dentist for over 100,000 people. A population over 100,000 people. I was the only dentist with no instrument, no tools, no materials. It was really difficult.
How could you perform your required surgeries and things? I mean, how did that work, Mario?
Improvising. Sometimes you need to use the same instrument, clean it, put it in a small autoclave that you have, told the patient you need to wait to do the next case. Imagine if you need to extract a wisdom teeth or you have a laceration in the mouth. Complicated cases was really difficult. To transport that patient for that rural area to the big city was impossible because we only have one ambulance. So you reserve that for a heart attack, for a patient with life-threatening condition. Since that small stuff like we were used to do in the mouth, like as a dentist, you don't want to transport that patient for that area. So you have to do it on your own. And you develop so many skills, believe me.
Oh, I can imagine. Now, I remember like it was yesterday, you were telling me the stories about being put in jail. And could you recount some of those? I mean, to me, they were so fascinating because weren't you accused of sabotaging your own practice and instrumentation and things?
Yes, that's what happened. Yeah, they one day the compressor broken, and they come and the people for the government came with the police, and they told me that that was my fault, that I was the one that sabotaged the instruments because I want to leave the country, and they put me in jail and was incommunicated for 3 months with no contact with a lawyer or family, just because they make a false claim that I was the reason that the compressor was not broken. So that's communist. They punish you for thinking different. They knew that I want to leave. They knew that I didn't was agree with the government, with the communists, because for me it was irrational completely. And as well as for the majority of my generation that we are here in the United States. And they didn't care about it. They put you in jail like without any rights. You don't have rights. So that was really difficult for me. But I think that made me the person that I am today. And I think teach me a lot about, appreciation, keep you humble, and appreciate every single thing we have here in the United States. Freedom, opportunities, work hard, and you can do whatever you want. I'm trying to transmit that to my kids too, because it's really important they learn that.
Oh, and I can only imagine how you must feel with your kids. I saw the pictures on Facebook. You were in Scandinavian countries with your beautiful family, and yes, life's been good to you, Mario, and you've worked hard for it.
I work hard for it, yeah.
So tell me, when this visa, came time that you could come to the United States, I don't blame you for wanting to get out of there. My gosh, I can't imagine 3 months in jail. What was that like? What was it like when you entered the United States of America?
Well, I remember I called my mom. My mom was a professor at the university in Camagüey, and I always told her, I think when I'm going to go to the United States, I'm going to have the most amazing experience. And the next day I called my mom. I told my mom, I will never forget, Mom, I feel that I just born again. This country is amazing. They welcome me here with, open hearts. And that was something that I feel so free, just to be able to travel and to be in the airport. And then when I enter and my friends picked me in the airport and went home, and they told me, oh, you have all the opportunities you want here and you can do whatever you want, I feel really, really released. Because I'm telling you, Jeff, at some point there when I was in Cuba, I didn't see the light at the end of the tunnel. I didn't know when they're going to release me. Because imagine, they say first 3 years, then become 5. And even after 5 years, I was hoping they do it and they never did it. And take me like 5 years and 6 months for them to release me. So in that kind of country, you never know what they're going to do to you. And when I came here to the United States, I feel so free, so happy to put everything in perspective. It was like a new me walking out that morning and say, now I can be a free man in a free country and do whatever I want. It's all in my side now. The ball is in my side of the park.
That's fabulous. So if I remember correctly, when you got into Miami, you had to work some just menial jobs to get by as you were preparing to go into podiatric medicine. Can you share a little bit about that story with us?
Oh, yeah. The first job that I have was cleaning the floor in a Mount Sinai hospital. So I was mopping the floor, all the nurses, all the doctors coming inside the hospital. And that was really depressing for me, but I knew what steps to go in. Then I worked as a dental assistant with the amazing doctor that gave me the opportunity. And after that, I started to apply to the universities, and Barry was really nice to let me do it. And in August 25, I was already at the university in my first class.
Wow. Now, when did you learn English? I mean, how did you get fluent in English?
That was really tough for me because I went to university without knowing any English. And all my friends and all my family members, including my mom from Cuba, told me, you are crazy, you're going to fail. I'm going to tell you this. You remember Dr. Cho, biochemistry. So Dr. Cho, the first test that we have, he gives one quiz. And in the quiz, he gives you one bonus question. Even the bonus question I failed because I didn't know he's going to give it for us. So I didn't understand that it was the answer was his writing in the board. So stuff like that happened to me. I have to study every single day until 1 o'clock with a dictionary in the library every single day from classes, then go to the library and study so hard until I start to pick it up and learn, really, really slow. But I start to pass the classes, pass, and then I start to be better and better. And I graduated, like, I think in the top percent of my class, So I was really a lot of hard work, but I did it.
Oh, Mario, I'm so proud of you. I can't even imagine going to a foreign country, not speaking the language, because medicine's a different language in and of itself.
Totally.
Oh my gosh, that's just incredible. So let's kind of keep this journey going here. You're at Barry University, came time to go to residency, and one of the things I wanted to ask you about is mentorship, because I know you worked a lot with Dr. Merrill and Dr. Losito. Can you share with us your experience of residency and then the fellowship?
Oh, Dr. Merrill and Dr. Losito were amazing. I remember I was a student and I went to Mercy Hospital to see the clinic and to see the work they put there. And I get, fascinated with the variety of cases they have, because they have sport medicine, they have charcot, they have trauma, they have, podopediatrics, ulcerations, everything that you want to see. And then they have the clinic, which also is really important because you can not only see the patient preoperative, but also postoperative. And then you have the opportunity to see professional athletes for the Miami Heat doing every year the physicals in the office. And it's a blend of patient population that is amazing and unique. And I said to me, I want to apply to that program. I want to be in that program. I got lucky that Dr. Merrill gave me the opportunity. And even to today's dates, I always call him for cases, complicated cases, and we discuss these cases, and he gives me advice. And the same with Dr. Losito. When I have sport medicine cases that I want to share with him, he's still my manager, my mentor, and he still gives me a lot of advice in these cases. Dr. Losito and Dr. Merrill give me the opportunity, and they become, friends and mentors that I will never forget. They were amazing to me, and until today's days, they are.
That's such a great story. And so let's talk about the fellowship for a minute, because you did 3 solid years, lots of surgery, lots of clinic. How did you decide to go do the fellowship instead of going into practice, for example?
Well, at that moment, you were the dean at the university.
I remember.
And you were a big part of me trying to stay as a university as a professor. I have to tell all your audience that I always grateful for the opportunity you give me to stay there as a teacher. And also you give me the opportunity also for being the director of the Jackson, just graduating 6 months after I graduated for my fellowship, you give me that position. And I always grateful for that opportunity. You trust me, and it was a really amazing experience, because I went basically for finishing my fellowship to doing amazing cases like open tibial fractures, pylon fractures, Charcot foot, doing, muscle flaps, crazy stuff. And that was only possible for me because you give me the opportunity to do in the fellowship and then stay as a professor there. You were the person that gave me the opportunity together with Dr. Losito. And I always thank you for that because you were really special to me and my family.
Oh, thank you, Mario. I don't feel like I was a great part of that because you earned every bit of it. I mean, when I knew you were in clinic and big cases were going on, I knew patients were being taken care of well. When you took over the residency program, I knew it was in great hands. And it's been fun following your career. And I commend you. You've done really fine work.
Thank you so much. But no, you were really a special part of that. And it's not because we are doing this podcast that I'm saying, but it's the truth, not only to me, but everybody here in Miami. We love you where you were the dean here, and you changed the university, and the research level went to another level. And the tenacity, the passion that you put in our profession, and we can feel it when you were here, and you still have a lot of that input here in a lot of college that we talk all the time, the good times that what Dr. Jensen was the thing here at Barry.
No, I love Barry for sure. Oh, yeah. Mario, those were very, very good times. Education's in your blood, giving back's in your blood. I was always impressed. Remember, you put together with a couple of our students mission trips to Togo, to Africa. You've been to Nicaragua. You've been to the Dominican Republic. You've been part of the Crippled Children's Project, which is now named after Dr. Sutherland. Can you speak to your passion for giving back and doing mission work and helping underserved areas to get really, really excellent care?
Yeah, as soon as I become a podiatry and I start to see Dr. Sutherland doing these mission trips, I become involved on that when I was a resident. And I went, I think, 9 to 10 times to Yucatan with the Dr. Sutherland project. And we did many, many cases in patients, with motor neuro disease like spina bifida, cerebral palsy, echinovarus deformity, limb lengthening discrepancy because of trauma, because abuse of the parents. I have the opportunity to go with Dr. Merrill and Dr. Sutherland to Haiti after the earthquake. I went with Dr. Maureen, one of the director of Palmero Hospital, with the Soul Foundation to Dominican Republic. I was in Ecuador. I was in Africa with Romain and team that you mentioned with the podiatry overseas. We went 5 times in the middle of Africa, a small village called Palime between Ghana and Togo, West Africa. It's the poorest country that you can even imagine in your life. They cook on the streets. They don't have any health system. Everything is really rudimentary. And in that conditions, we were able to help many, many, many people. Every time we went, we performed over 20 cases. Dr. Gamal, the surgeon that was there trained in Switzerland, he has the perfect connection with us because he has the level to follow this patient after we left. And we performed several cases there. I remember we did an open tibial fracture in a guy that have only tetracycline by mouth for 2 days, previous 2 weeks before we got there. So after 2 weeks of the fracture, we got there, we put the frame, and we saved the leg of this guy that have a common tibial fracture, and he walked 10 kilometers after we come back to say thank you to us. So experience like that change your life because it's so touching to you, to your soul, because these people, they don't have anything and they appreciate everything you do for them. So I think, yes, that's in my DNA. I enjoy it and I keep doing it. And we're planning already going back to Africa next year. Obviously, COVID, delay us and stop us. But now we're planning to go back. And the reality is that I want to keep doing it. And I think it's something that a lot of us here in the first world country, we should do, because a lot of this country, they need it, and they need it big. And I think also give you a lot of experience, train you to another level, and you can compare also the difference between this patient population and our patient population. And we talk about the host system, how they respond different to this treatment that we perform here in the United States, in this country. So it's been a great experience for me. And I'm glad you mentioning, and I think changed my life. And I think everybody that does a little bit of mission trip can tell you that it's an amazing experience, because when you go to bed, you feel like you really touch somebody's life and you change somebody's life when you save these legs of these people in these poor countries. It's really different.
Absolutely. When you would come back from Togo and show me the slides and some of the trauma you were treating and the deformities you were correcting, it was unbelievable cases. And Romain, I haven't talked to Romain in a while, but are you still thinking about going to Togo with him?
Yeah, I remember you were thinking to coming one time, and Dr. Losito also want to come. Yeah, that was amazing experience. Africa trip were amazing.
Absolutely. Well, that's fantastic, Mario. So let's talk about practice in Miami. I mean, a couple of years ago, you and I got together and did a big workshop in Miami, and I was talking about offloading with total contact casting, and you were talking about surgical offloading. That was such an enjoyable experience, and we had a lot of doctors we were working with. Tell us about your current practice, the type of work you're doing, the kind of things that really get your attention that you enjoy doing in the operating room.
Yeah, no. Right now, I a co-owner of two offices that we have here in Miami called Perfect Fit Care, and my wife and my partner, we the three of us work in the two offices, and I go to 3 different hospitals, and I work with the residents and the students still in these hospitals. But mainly, we are focusing now on external fixation, limb salvage, like you mentioned, offloading for these complicated diabetic wounds that most of the time they need to go to amputation. And we combine muscle flaps with the external fixation. Sometimes we combine the wound care part of the deformity with bone consolidation and fusion, especially in charcot patients. And I do a little bit of trauma still, like open fractures, pylon fractures, mainly with external fixation, but I sometimes use internal fixation too. And my practice also have a little bit of a minimal invasive surgery. I use a lot of these minimal invasive procedures to do subtalar joint fusion, ankle fusion, bunions, and I'm trying to incorporate a little bit also in the charcot population, trying to make incision smaller for these diabetic patients. You know that soft tissue healing is a big issue for them, and sometimes you heal the bone, but now the soft tissue become a problem. And I'm trying to increase the outcomes, and I'm doing some papers actually working with the residents to publish some of this data. Make a small incision, doing the small bars, a small burr, and small blades to make, prepping the joints in a way that you don't traumatize the soft tissue too much, and then apply the external fixation and compress all this deformity. I think that's the future of the charcot, and we have a lot of companies now developing a lot of, new technologies that we can use it. And I think that's what weigh me now today, thinking about trying to save these patient legs with a lot of bone ulceration that are really difficult to treat, because these patients have a lot of comorbidities. It's not only the metabolic problem they have in the bone, but they are sick. They have end-stage renal disease, heart problems, and psychological problems. And these patients are really difficult to treat, and a lot of doctors don't want to deal with these patients. So I think few of us, we need to, take it to another level and treat this patient, because if not, they're going to have a lot of below-the-knee amputation. And the data support that we save the leg versus amputate, over 50%, after you have a below-the-knee amputation, over 50% 5-year life expectancy in this population is higher than any cancer of cardiac problems. It's crazy the amount of patients that died after you amputate the leg if they have diabetes. So we need to try to limb.
So Mario, I know you're at the cutting edge. I know obviously you're very industrious, right? I mean, you're trying new techniques. Your history of, working as a dentist in Cuba attests to that. So what's coming out new? What are you working with companies from a fixation perspective that are really going to make some big differences in the next decade or so?
I think that's a great question. I think 2 components. We need better fixation, better nails that compress and distract at the same time, because one of the problems we have in this diabetic population is most of the time, especially in the high foot charcot, we remove the talus and now we have a short leg, so we have a little length discrepancy. So we are starting to think about lengthening that legs, and I think nails that distract and compress are going to be the next step, and they're already in the market. And also, I think we need more stable fixation that can pass the area of fixation. We're talking about better nails in the midfoot, better bends, better bolts, and better plates and screws. And in the biological part, we have few companies like, for example, Right Medical Cell to Striker Augment. We have a big paper about Augment. It's a PDGF that increase bone healing and have a over 90% success rate in ankle and subtalar joint fusion when you use Augment. So biologics are really important. There are other companies coming with other kind of bone cement that you can incorporate it, also antibiotics. And I know it's a company already in the market that have that component that you can use bone cement, hydroxyapatite, and gentamicin together. And if you have an infection, inject that cement inside the body and consolidate all that. And I think it's being used a little bit now, like they don't have big papers, but it's being used with great results. So I think the biologics are there, and the hardware is also oxide and it's coming better. I know there are several companies investing in new charcoal products, better hardware that is stronger and facilitate the fixation in this patient.
That's great, Mario. And I have no doubt you're on the cutting edge and will continue to push for better outcomes for these such difficult patient populations.
Totally. Yeah, and I'm currently speaking for Stryker and Bilex, and we're trying, to educate people all over the country about what we're doing. And we have amazing panels that we go, like 3-4 times a year, national courses, and we invite residents, fellows, and physicians, surgeons that are practicing already, trying to educate them. And we are doing it in a different way, because most of the time we're mixing orthopedics and podiatry together. What I think is great, because now you have a discussion that is bigger and have a bigger impact and more credibility also, because now you have orthopedic surgeons and podiatry together discussing about these complicated charcoal cases. So I love it that way. We're doing really good.
That makes sense. And I'm sure the residents thoroughly enjoy working with you. You push them to their limit, I'm sure.
Yeah, the residents always a really interesting part of that, especially with Mercy residents that I work really close. They are now together publishing a post about a patient, a non-compliant patient, that we have to do several surgeries to try to save the limb, and we did it. And we have just come out a paper about calcaneal fracture with Merrill that I published last year in the Dr. Dockery paper, Journal of International Foot and Ankle Foundation. And we're working another paper that we want to put a retrospective study for charcoal patient. And we want to look 5 years before and 5 years after how this patient was doing with the x-rays, because I think we need that kind of paper that look 5 years after you've done the surgery. It's complicated because it's difficult sometimes to find this patient 5 years after you do the surgery. These patients are not compliant, but we're trying to have at least 20 to 30 patients to have that, a study put in together. So the residents are being with me and they love it. And, we're doing amazing cases. We are doing like fibula allograft. We're bringing the fibula as an intramedullary nail and we put inside the medullary canal. We are, doing peroneus brevis muscle flaps. We are bringing also allograft bone, like to support the fusion in the ankle in these complicated cases. And we're using also cage. That is a new technology also. And we are using also the 3D talus, metallic talus, completely printed in 3D. And then the actual talus, we have it in the patient and we compress it and we put it with the frame. So we have crazy cases coming and we're doing all that with the residents. So they love it. They love these complicated cases that take them to another level.
That's incredible, Mario. It doesn't surprise me that I makes me wonder when you sleep.
Well, sleeping is no part of my schedule right now. Imagine me and my wife being both of us physicians and going home and have 2 kids, 7 and 3. And they always want to do activities, like taekwondo, soccer, this and that. So on the weekends, we don't have too much time to sleep, neither during the week. But we enjoy every second. That's where I came from Cuba here, to do my passion and to work hard and to help as many people I can help and enjoy my family too. So I'm really blessed, like you say, and I'm really happy that I can be able to become the person that I am today and the family member that I am today.
Mission accomplished. Yeah, as I follow your family, you're in Miami and around the world when you in your travels, you certainly are taking advantage of the freedoms that you've worked hard to earn. There's no doubt about that.
Totally. I love to share with my kids, about freedom and the ability they have to travel from the whole world. But at the same time, I show them, a little bit of art, architecture, museums, history, and also to stay humble and to appreciate what they have, because we take that for granted every day. And we need to take our step back sometimes and talk about the things that, other people don't have. And I'm trying to show them that too in our trips, that they can appreciate. Not everybody have everything that we're here in the first world we have. And I think that's really important that we take our step and think about that.
Absolutely. Perspective's everything, right?
Everything.
If you've never experienced the hardships that you had in Cuba, you might come to think that the United States of America is nothing special, perhaps, but it's the greatest country in the world, no doubt.
And I'm glad that you mentioned. Yesterday, my best friend called me, and my older son, he's going to New York, Fordham University. He's going to study philosophy, pre-law school. So he's leaving in August, and he got accepted there with a scholarship and everything. I'm really happy, and I'm really proud of him. And my best friend was telling me, I need to sit with your son before he goes to the university, and told him everything about you. What was your journey? The hard work that you have to put in Cuba to get in dental school. The hard work that you have to put to come to the United States. And then when you were here, the hard work that you did. Because if you told him yourself, he's not going to believe it. But if I told him the vision that I have from your father, he's going to appreciate it in a different dimension. And I told him, well, I really appreciate that because I think you're right. So yes, we need to appreciate everything that we're done.
Absolutely. You remember my son, Joey, he was really little when we were in Miami. He's 21 now. He graduated from college and he's studying to take the LSAT. He wants to be an attorney also.
Oh yeah, congratulations! I saw him on Facebook too. He looks like a handsome guy. Yeah,
yeah, he's doing great. The whole family's doing great. Mario, Celia's doing great. She wanted me to say hi to you today. I was preparing for this podcast, and we're recounting some of the experiences and stories. And she definitely wanted me to say hi and wish you and your family the best.
Told her that I say hi to, and thank you for saying hi to me.
Not a problem. So Mario, let me ask you a couple other questions just for fun. If you were a student, an undergrad student, and you were contemplating a career in podiatric medicine, what would you tell them?
I tell them it's an amazing profession. You have a lot of opportunity. I don't think it's another profession in the medical field that have so many opportunities as podiatry. You can do kids, you can do adults, you can do sport medicine, you can do wound care, you can do trauma, and you can combine everything together as you want. You can do limb salvage, you can work in a wound care center, you can go in the office, you can be in the hospital. I told people that want to shadow me, this is me coming from a dentist perspective, that the mouth is so small and you're restricted just to the mouth and you cannot do anything else. And then go to podiatry and see the amount of possibilities you have as a podiatry. And the big opportunities you have as a podiatry is amazing, because I can compare and I can tell these students that podiatry is an amazing profession, that you can develop any skills that you want and concentrate in one thing or do many, many things that I do. And you never get bored with podiatry. You never get bored. I can tell you in my office, I see a guy with a sprained ankle, an ankle fracture, an ingrowth toenail, diabetic ulcer, a kid that have, into walking. And then in the afternoon, I can see, 3 or 4 patients with, plantar fasciitis or Achilles tendonitis. We inject, PRP or stem cells. And then at night I have, 2 or 3 surgeries, or early in the morning I have surgeries. So you never bore here, because your mind is always going to be active. And it's a profession that is amazing. And I think we have an amazing population in every big city that need a lot of well-trained podiatrists. And I think you as an educator and as a dean of one of the most important schools in the country can vouch that we need more and more of this young generation that are better than us to serve this population. So do it, do podiatry, and I encourage everybody to do it because it's an amazing profession and you have a lot of opportunities.
Absolutely. Well said, Mario. Yeah, pay it forward and train them up. I mean, that's really the ticket. Say, Mario, before we end here, I just want to extend an invitation. We'd love to have you out in Arizona. Bring your family out. Wait until it cools off a little bit, though.
Okay.
We'd love to have you come out and address the students and talk about some of the phenomenal, groundbreaking work you're doing in Miami. So congratulations on that.
I appreciate that. And I for sure will love to go with Natalie over Arizona and visit you and Cecilia and your amazing family.
And say hi to Natalie. And by all means, make sure you bring the kids with you. We'll have a blast.
Sure, for sure.
Okay.
For sure.
Well, Mario, I want to thank you for taking time out of your busy schedule. I want to thank you for all you've done for our profession. Thank you for your energy. It's contagious. I am jealous of the residents that get to work with you every day. I'm sure you're training them up and they're going to be phenomenal doctors. So again, thank you so much for joining me.
Thank you, Dr. Jensen. Let me tell you, I always grateful for the opportunity you give me. And I always tell everybody how a good leader you are for our profession. And we hope we have hundreds and hundreds of more surgeons and educators like you. We're really happy to have you here leading one of the best podiatry schools in the country and to doing these podcasts that educate people and show leader of the profession. Thank you for having me. And I love you forever, my brother.
Love you too, Mario. Thank you. And to all of our listeners out there, thank you for tuning into Dean's Chat again. I really hope you enjoyed this episode. Mario is one of the great students and residents I've had the privilege of working with. And I'm so proud of you, Mario, and seeing what you're doing. If you're listening on Spotify or Apple Podcasts, please give us a 5-star rating. And if you're watching on YouTube, do become a subscriber. And Mario, I don't have my cup here, but I'm going to send you a nice little Dean's Chat cup that you can drink coffee out of every day.
Thank you so much.
All right. Cheers, Mario.
You want to subscribe for the YouTube channel for sure.
I look forward to it. All right, Mario. Thanks again. Say hi to the family now.
Bye-bye. Thank you.
Cheers, everybody. Bye-bye.